Depending on your life experiences, the acronym AAA conjures different things to mind. If you're a member of the military, you might think of anti-aircraft artillery, or possibly the Morse code for an aerial attacker. If your car has ever broken down on the side of the road, you might think of that helpful American Automobile Association. And if you're a doctor, AAA might mean an abdominal aortic aneurysm, which is a very serious dilation of the abdominal aorta.
It's a weakening in the wall of the artery, and this is the main artery in the body. The aorta at about the level of our belly button splits in half, and each half goes into a leg. So that's how our legs get blood. And right before the aorta splits, that's the most common location for an aneurysm. And we still don't know why the weakening occurs in that area, but that's where it occurs 95% of the time.
It's very difficult to know if you have an aneurysm unless you have symptoms, which sometimes only arise once the artery is ruptured. These symptoms are severe abdominal or back pain, or a pulsing sensation in the abdomen, chest, lower back, or scrotum.
We really don't want to wait until there's symptoms. That's why as soon as we find out about an aneurysm, if it's a certain size, we strongly recommend getting it repaired. If you have the aneurysm repaired electively, your chances of doing well and surviving and having a normal life are probably about 97 or 98%. If you wait until there are symptoms, which means the aneurysm has ruptured or burst, your chances of coming through surgery for that and surviving are probably 50% or less. So it's a totally different situation if you develop symptoms and the aneurysm is getting ready to burst. We want to avoid that at all costs.
The exact cause of this weakening in the abdominal aorta is unknown, but we do know that some people are more prone to it. It occurs most commonly in men between the ages of 65 and 75. It's also more common in patients with high blood pressure.
We do know that it's a genetic disease. So whenever I have a patient with an aneurysm, I always tell them that they should inform their siblings and their children to get an ultrasound. Their children, once they reach the age of 50, and their siblings should just have a simple screening ultrasound, because if you have an aneurysm, then there's a 1 in 5 chance that your brother, sister, or child will also have an aneurysm. So we know it's genetic.
An abdominal aortic aneurysm is usually diagnosed by a physical exam, ultrasound, or CT scan, which has a nearly 100% sensitivity for aneurysm. These imaging modalities will not only reveal if an aneurysm is present, it will also show doctors how large it is. The normal outer diameter of the aorta is around 2 centimeters. An aneurysm is diagnosed if an aorta is dilated to over 3 centimeters. A large aneurysm exceeds 5.5 centimeters in outer diameter. If the aneurysm is found before rupture and is large enough to pose a serious threat, then AAA repair may be recommended.
What we have to do is replace that weakened or damaged part of the artery with a plastic tube. And again, in the old days, we would use a big operation to sew that tube inside the aneurysm. Now we can do most of these through a small groin incision. So it's much better for the patient.
There's one thing you can do to prevent an abdominal aortic aneurysm. Don't smoke. More than 90% of people who develop AAA have smoked at some point in their life. Thankfully, the risk of an abdominal aortic aneurysm decreases slowly after one stops smoking. Just another good reason to quit. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.